Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and this broadcast is available to you from Loma University Health's Department of Risk Management. We are so glad you joined us today because we have a topic today that really affects so many of us. As you know, our lives are becoming longer and longer, which also means that we have a lot of children that are starting to care and even maybe in some cases worry about their parents, their aging, and their health. Well, today that is exactly what we're going to talk about. What potentially can you do to help care for your aging parents? We have a wonderful speaker here today. His name is Dr. Todd Martell, and he practices internal medicine. He is one of our wonderful internal medicine doctors here at Loma Linda University Health. He is also the Vice President for Population Health and Quality for the Loma Linda faculty medical group. So he wears a lot of hats, but of course, more importantly, in my opinion, he's a very good friend of mine, and I so appreciate everything he does, not only for me, but for our institution here at Loma Linda. So without further ado, I'd like to introduce you to Dr. Todd Martell.
Close the door.
So Dr. Todd, you can actually take it away and start sharing your screen.
All right. So thank you. And sorry for that little pause, but I want to talk to you about our aging parents and how we can navigate their health. Want to understand the Medicare annual wellness evaluation, identify ways that you can assist your parents in their health care, and some crucial conversations for end of life that you need to have. So Medicare is great, and they want to make sure that your parents or we are healthy and avoid problems. So once a year, they offer a free, with no deductible or copay, wellness evaluation. It screens for nutritional challenges, diabetes, and some cancers and cardiac conditions, reviews and covers most recommended vaccines, promotes exercise, safety, and evaluates for independence. And what it does not do, it does not have a physical exam, although many providers will do that exam, when the patient's there. It does review a patient's physical system concerns. One of the things we look at is diabetes, right? So diabetes causes heart attacks, strokes, kidney failure, neuropathy, blindness, erectile dysfunction, usually gets most people's attention, vascular disease, and amputations. These done with a fasting blood sugar or hemoglobin A1C. Multiple ways to treat it, including diet, exercise, and weight control. Obesity, affecting about 40% of the US population, is another big cause for disease. You use a body mass index, otherwise known as the BMI, which is a height to weight ratio. And normal, being underweight, is less than 18.5, normal 18.5 to 25, overweight 25 to 30, and then obesity anything greater than 30. Interesting enough, those over 65 actually benefit from a few more pounds of protection. There's an increased risk for death for 65 and above when the BMI is less than 23 or greater than 37. Obesity definitely increases diabetes, cardiovascular disease, obstructive sleep apnea, mental health disorders, cancers, dementia, and arthritis. If you can't get the BMI, because you can't get on a scale or measure, a substitute for that would be a waist circumference. And anything greater than 35 inches for women or greater than 40 inches in men is an increased risk for metabolic syndrome. Cardiovascular disease is a cause for 31% of all deaths. The Framingham study showed that 1 out of 3 women or 2 out of 3 men would end up having some form of cardiovascular disease, which is coronary artery disease, stroke, hypertension, rhythm disorders, atherosclerosis, heart failure, valvular disease, and peripheral vascular disease. Screening involves checking for the blood pressure at the annual wellness visit and screening for cholesterol. The ideal cardiovascular health involves optimal lipids, blood pressure and blood sugar control, healthy diet, appropriate energy intake, and regular exercise and avoiding tobacco. And Cancer screening is another thing that we address. Basically, colonoscopies and stool tests for colon cancer are done based to look for cancer. Breast cancer screening, women have a 1 in 8 chance of getting breast cancer. So a mammo every 1 to 2 years from the age of 50 to 74 for the average risk women. If women fall out of that and have other special risk factors, then certainly a different frequency is recommended. Pap smears are recommended until age 65, after which most women won't need any more. Prostate cancer screening. Lots of debate on what to do and how often to do it or to do it at all. And so it becomes a shared decision-making between the patient and the doctor, looking at risk and benefits of screening or not. Done with a digital rectal exam and a PSA. Skin cancer, you want to be looking for any new or changing lesions. Vaccines, lots of debate out there. A lot of people feel very strongly about vaccines, pro or against. Current recommendations are an annual flu shot, which is done in the fall, right before the flu season hits. Pneumococcal vaccines, a one-time deal at the age of 65. Shingles, painful recurrence of chicken pox, usually affecting 1 or 2 dermatomes on one side of the body, hits about 30% of people. So a vaccine can be very helpful in preventing that. It's not necessarily covered by Medicare, but you gladly give whatever it costs to get rid of the shingles if you were to get it. COVID vaccines, lots of discussion out there in the media, and then certainly tetanus boosters recommended every 10 years. It's not a covered benefit by Medicare, but they do cover it if you get a dirty cut or wound. 1/3 of patients over 65 fall, and 1/2 of those over 80 fall every year, causing cognitive defects, medications, leg weakness, gait, balance challenges, and medical illnesses are common causes. The annual wellness visit, AWE, screens for falls, and if indicated, a timed up and go test is done where the patient gets up from a sitting position, walks 10 feet, and comes back and sits down. Normal is anything less than 12 seconds. More than that requires further evaluation. You want to promote exercise to enhance balance, gait, and strength training. Evaluate the house for any tripping hazards. So those cute little throw rugs in the kitchen and the living room can set mom up for a trip and a broken hip. Get rid of those cords that are running around in lamps, extra pots and plants sitting out in the hallways, increasing risk for falls. Many patients have multiple medical problems, and the more problems you have, it seems the more pill bottles you have to open up every day. And polypharmacy can be a big problem for falls. You want to avoid sedatives and sleep medications. So a lot of people end up becoming dependent on Xanax or Ativan for anxiety, or using them for sleep, or Ambien's another common one for sleep. Those end up increasing risk for falls again too. So trying to avoid those. And then evaluate and treat for any visual impairment. Vision problems affect 1/3 of everybody over 65. Whether that just be from reduced visual acuity, presbyopia, needing reading glasses, cataracts, glaucoma, macular degeneration, and diseases related retinopathy. Osteoporosis affects 1/3 of women and 1/5 of men over the age of 50. Definitely increased risk for fractures, with 15% of women and 5% of men having a hip fracture by the age of 80. A bone density test known as a DEXA scan is how we screen for that. Results come back as normal osteopenia or osteoporosis. And I basically tell my patients that's like going from cardboard to typing paper to rice paper as far as how sturdy it is. Prevention basically involves getting rid of modifiable risk factors, i.e. get rid of your alcohol, smoking. Patients with low BMI are at increased risk, and so making sure you have a normal body weight, proper nutrition, and weight-bearing exercise are also very important. Vitamin D and calcium supplements can be done. There are multiple medications to improve bone density if osteoporosis ends up happening. About 15% of people over 60 have depression. It's quite a bit. And symptoms can be confused for cognitive decline. It can negatively affect outcomes of other diseases that are being treated. Screening tool used in the annual wellness evaluation is a PHQ-9 or potentially a geriatric depression scale. Medication is usually first line in treatment. And what you really want to do is also evaluate and see how you can support your parents with lifestyle. So encouraging regular exercise helps treat and prevent depression, as well as avoiding isolation. So encouraging them to get involved with their church, this senior citizen center, volunteer opportunities, any place where they're going to be able to get out and be part of a crowd. Hearing loss affects 80% of people by age 80. It's isolating and can cause depression and perceived memory loss. You don't need to screen everybody, but if you do notice a hearing loss, a good audiologist and potential referral for hearing aids, if indicated, can do a lot to help. Cognitive decline is a challenge, and looking for any zone where patients start to lose their ability with memory, language skills, visual spatial function, or higher levels of executive functioning, planning, adaptable thinking, self-control, or time management. A mini mental status exam can be done in the office. It takes about 7 minutes to do. Independent living. When do you need to call in somebody to start helping mom or dad out? When do you need to think about transferring them into assisted living? The obvious pieces there: bathing, dressing, transferring, toileting, and feeding need to be assessed. And then, but the independent activities of daily living, are they paying their bills? Are they able to communicate, call on the phone? Can they shop? Are they able to cook their meals, manage their medicines, and do their house and yard work? What's not part of the annual wellness evaluation is a situation with driving, right? But definitely a conversation that oftentimes comes up, and question comes up, when do you retire from driving? That's a new buzzword. When do you get your driver's license taken away? But when do you voluntarily decide to retire? Drivers 65 and older are 16% more likely to cause an accident than adult drivers between 25 and 64. Medication side effects, reduced cognition, impaired vision, as well as loss of mobility or slower reaction time from arthritis or strokes can definitely affect your ability to drive safely. Many seniors will self-restrict and start limiting their driving when they don't feel safe. Deficits are often gradual, and awareness comes with that first accident. Driving retirement is a definite loss of independence and often results in isolation and depression. Being aware of that with your folks. What can you do is probably the most important thing, I think, is stay connected. Having an ongoing, active relationship with your parents helps to make sure that you're aware of what's going on and allows you the ability to insert yourself when necessary. One thing is, just ensure that they are comfortable with their computer and smartphone. Not everybody's tech savvy, but I've got some very tech savvy 85-year-olds that are text messaging me all the time, on my chart. But making sure they know how to get online with their appointments and log on for video appointments. Discuss their health concerns with them. Encourage them to get their annual wellness visit. The other piece is model, right? So role modeling, healthy lifestyle choices with exercise and diet. You want to go to the clinic visits with them, whether it be virtually or even in person. Very helpful as a provider to have the son or daughter, express their concerns and be that second set of ears to hear what the instructions are and make sure mom and dad know what needs to happen. The next thing is to obtain proxy to their medical record. Now, that's not necessarily right off the start, and certainly your kids, as they go from infant to child up to adolescence, you start losing the ability for proxy. In this case, it starts to reverse now, and you're going to start inserting yourself there so that you can know what the doctor said, know what medicines they're on, be able to review their lab results with them. Help them with their medications, pill boxes, It's going to be very challenging if you've got 3 or 4 or 6 different pill bottles to open up once or twice a day, and did I take that one or not? So having a pill box set up with here's the week's pills makes it much easier for them, as well as sometimes actually getting pill packs where they can just punch out Monday's pills in the morning and that's all done for them. That's done at the pharmacy. And then the other is look for and create opportunities for crucial conversations. So having those difficult things so that you can avoid problems.
Well, thank you so much, Dr. Martell, for this part of your presentation. There's so much information, and we have people sending in their questions. So if you are a viewer that is watching us live, go ahead and type your questions in the comments section, and we can ask Dr. Martell right here, right now. Couple of things, Dr. Martell. You use the term reduce polypharmacy. For those of our viewers who don't know what that means, could you define polypharmacy for us?
Polypharmacy is basically, more than one pill. So you take 2 pills, 3 pills, 5 pills, 10 pills, and sometimes they interact. You would like to be able to say, I don't want any pills, right? And it becomes an option of I'm going to treat or not treat. But that's a discussion that you have with with your provider, and saying which of these medicines can we get rid of? Are they all necessary? Do some of them interact? And so really becomes a challenge when a patient is seeing multiple providers for different things, and then not everybody stays in tune with what they're giving the patient.
Okay, great. We have another question coming through, and I think this is a great one. Can you suggest strategies for organizing and keeping track of medical records, appointments, and medications for our aging parents? It can be a lot sometimes, especially if you're managing both of them.
Well, that's a great question, and certainly can be challenging. You're right. So the more doctors your mom's seeing, the more physical therapy, surgery appointments, pre-op appointments, it can be very challenging. So that's when the proxy access is very helpful, because you can get on my chart and you can see which appointments are coming up, when they are, and it's very helpful.
And so what Dr. Martell is talking about, just to elaborate a bit, you probably have a portal that you can access your doctor and make appointments, and it's an online portal. What can happen is when you have parents, they can give you access to their portal. So you can see everything that they see. Just like with you, you know when your doctor's visits are, you know what medications are prescribed, potentially refills and everything else. You can actually see all of that for your parents as well. Another question we have coming through is Medicare supplemental can be confusing. What is a good tool to know the differences between our options?
I think probably the best option for some of that is actually to go to a broker. Because the brokers are very well aware of the different insurances out there, what the bells and whistles are for each one, and whether you get a supplemental insurance or sign up with the Medicare Advantage. Medicare Advantage, basically you sign over your Medicare benefits to a health plan, and then that health plan is contracted with different provider groups in your area, and you pick one of those provider groups to be your go-to for everything. You lose some of your freedom to shop around, but at the same time, it definitely is much more cost effective, I think, for most people. But check with the broker, and they can go over, what will work best for you.
And am I correct in saying, Dr. Martell, there are certain rules surrounding Medicare as well? So if you go to Advantage, you don't know, you can't kind of change back to a different, there's rules, and a broker can help walk you through them.
Exactly. So they know the rules, they know the pros and cons. And even when you look at Medicare Advantage programs, SCAN versus United Healthcare versus Anthem Blue Cross will have a little bit different bells and whistles that are attracting patients. Some of them have a maximum out-of-pocket copay. So once you reach that, I think $3,600 is a common one, then you don't have any more expenses. Now, and then some of them have different medication coverages than others do. So that's where you kind of try to tailor it to what your needs are.
Perfect. Another question we have, we have some great questions coming through. How do you get control? That's interesting how they put it. How do you get control of parents' care, but they refuse?
You know, you ask that same question when you are the parent, right? How did your parents control you when you refused to come in at curfew, when you didn't pay, do your homework, when you didn't do your chores? And that's when I talk about being engaged. You have to have that ongoing relationship where it's trust and your opinion, because this is where a lot of children, adult children, get very frustrated because mom or dad does not want to do what they want them to do. And to remember, mom and dad are adults, independent. They've been doing their own decisions for the last 60, 70, 80 years. And unless there's some significant cognitive impairment, they are still free to do what they want. So your point of influence is going to be on the relationship that you have with them.
Okay, great advice. Here's another one. What resources are available to emotionally support family caregivers? Caring for parents, for example, who have dementia can be very exhausting.
You're right. And there are societies for Alzheimer's, let's just talk about Alzheimer's groups. And off the top of my head, I can't give you any to send to, but there are groups out there that have support systems for that.
I think this is probably, to your point, Dr. Martell, to engage the internet, because there are groups, there are online groups for different diagnoses, different national organizations that might have local chapters near you. There's a plethora of resources available, and they could be as close to you as your local church or your local community hospital that has groups that are available to you. Okay, Dr. Martell, we could go through a bunch of questions, but we probably should get back to your second half of your presentation.
All right, let's get the screen going here. And so one of the things I like to focus there again is, what does the Bible actually have to say about how we should be engaged with our parents? In Ephesians 6, 2 and 3, honor your father and mother, which is the first commandment with a promise, so that it may go well with you and that you may enjoy long life on earth. Crucial conversations are really important to have. And part of how you're going to honor your parents is respecting what their wishes are. And what kind of care do your parents want to have? You've all heard those horror stories, right? Where the 102, this is actually one of my patients, but the 102-year-old grandma who's up in a fetal position, can't move, can't communicate, now can no longer eat. Family puts a peg tube in her so that she continues to get nutrition. Quality versus quantity of life is, and different people have different opinions on that and different wishes. So knowing what your parents' wishes are is really important. How do you avoid being the parent who ends up with a stroke, no longer can think or communicate, kind of in a vegetative state, but ends up having CPR, put on a ventilator, and then the kidney shut down and is now on dialysis, but nobody wants to say, oh, we're going to pull the plug and we're going to let mom or dad go. And, or, your brother who's been living in Alaska for the last 10 years has had nothing to do with your parents and now feels guilty because of his absence. But dad's about to die, so I'm going to sit there and make sure that they do everything for him. I'm going to be the hero and save him, make up for that lost time. Having conversations now before your parents get sick is really important, and knowing what their wishes are. You can respect their end-of-life desires when the time comes. Having some spiritual care, or what is mom's idea about death or life after death, and certainly makes a big difference. As Christians, we think that we're going to be going to heaven. The thoughts out there, you either go immediately or you're going to be sleeping in a grave till the Lord comes again. either way, the next thing you know is going to be the Lord in pain. So sometimes, like, why do we sit there and try to hang on to life and give me another 6 months of agony, when death can be a very kind and compassionate way to transition there before you go to heaven. Durable powers of attorney are important to have and set up before they become necessary. Advanced directives in pulse form. An advanced directive basically identifies a healthcare agent to make medical decisions for you when you're too sick to make them yourself. It outlines healthcare choices regarding CPR, cardiopulmonary resuscitation, use of mechanical ventilation when you can't breathe for yourself, dialysis. So if your kidneys shut down, are you going to get your blood filtered, 3 days a week in lieu of the kidneys? If you no longer can feed yourself, are you going to get feeding tubes put in, whether that be temporary or long-term, and certainly blood transfusions? So there's a form, you can get it on the one portal, Advanced Directives, and basically fill it out, sign, have 2 witnesses sign it, or get a notary public. And then you want to make sure that anybody that's necessary has that information and knows it. So give it a copy to the doctor, as well as, all your siblings and anybody else who may be involved with the healthcare of your parent or yourself, for that matter. Physician's orders for life-sustaining treatment, otherwise known as a pulse form, is basically the advanced directive on steroids. So it is a medical form that gives seriously ill patients more control over their care by specifying the type of medical treatment the patient wishes to receive at the end of life. When do you do this? When they're seriously ill, right? So basically, this is what the form looks like, and you get it filled out. It addresses at CPR, the level, how do you want full treatment, partial treatment, a trial of full treatment, just selective things that don't do CPR, but give me IV fluids, antibiotics, pain medications. Are you going to just address comfort care? Are you going to send me to the hospital or not? And if so, what are the conditions of sending me to the hospital? Or do you just going to say, you know what, I want, if my time comes, keep me comfortable and keep me at home? So this form should be kept at the bedside, the nurse's station, on the kitchen fridge, wherever the patient is, and then it goes with them whenever they're transferred to someplace else. It works in tandem with that advanced directive. Basically, all adults should complete that advanced directive. So anybody on this form right now, do it for yourself and have your parents do it. Update it periodically as indicated in any changes of your health or decisions. And then when you get diagnosed with an advanced illness or frailty, complete the pulse form. Update that pulse as necessary, and that's how you're going to make sure that your treatment wishes and your parents' treatment wishes are honored. One of my colleagues is talking about a legacy drawer, right? So how do you keep track of all of these things and know where they're? So a legacy drawer, right? So keep your advanced directives and the pulse form there. Know the primary care's info. Get copies of the insurance cards, financial information that's important for your parents, proxy access, and then a durable power of attorney. And then if you ended up having to take mom's keys away, that's where you can keep the missing car keys. Children's children are a crown to the aged, and parents are the pride of their children, Proverbs 17:6. So Olivia, anything else, Dr. Moses? Appreciate your ability to throw those questions out.
Sure. No, we have some questions coming in as well. And this is so important because I think a lot of our viewers have never heard of these forms before. We actually have one of our viewers that shared that they can attest to making sure that pulsed form is signed by your parents while they are mentally stable. And that's a key, aspect of this whole process. One of the questions that have come through is, what are some of the questions to ask about end of life wishes? Like, where do you even start having that conversation with your parents?
That's great. Probably the timing is good. I wouldn't do it at the birthday celebration. But afternoon talks, when one of their friends passes away, when someone gets sick, boom, what do you want? When you hear a story, someone at church just died or got sick, that's a great time to say, what are your wishes? How do you feel? What would you want done for you? Do you feel strongly about it? Some people, are very strong opinions. Don't do this and that. And other people are like, I want everything. And I think part of that has to do with just some of your thoughts of death and what to expect afterwards.
And I think, to your how you so eloquently kind of labeled all of these forms, it may be a good idea. What are your thoughts, Dr. Martell, to actually acquire these forms from the internet? There's examples of them, and maybe see what you have to fill out, and maybe start the questioning with what you actually have to fill out on those forms if you don't even know where to begin your questions.
Oh, that's a great thing. Hey, advanced directives. We just heard that this is a good thing to have. Make sure you stay in the driver's seat so that when you are unable to make those decisions or calls, you've already outlined what you want your wishes to be. That's the real important piece in there. And so, downloading them now, and this weekend when you go over to mom's house after church, or Sunday afternoon, whatever, is like, hey, let's look at these and let's get them filled out.
Absolutely.
Or at least start talking about the questions. What do you think? And then, and the beautiful thing about those is they can be changed at any time. So it doesn't freeze you into a decision.
Oh, that's good to know. That's good to know. We have another question that has come through. How would you recommend dealing with a parent that does not want any diagnostic tests or treatments for disease, since she's 80 years old?
That's her decision. And respecting that is what I would say. You can talk about the benefits and risk of not doing something, but some people feel very strongly, I'm not getting a mammogram, I'm not getting my immunizations, I'm not doing this, I'm not getting any blood work. And that is their choice.
No, this is great. I know this is maybe unusual, but Dr. Martell, do you mind bringing up that slide again of the things you should keep in your drawer? And maybe that's how we should close out this talk today, because that is kind of our to-do, leaving this discussion here today.
Sure.
So can you go over very quickly these things again?
So advanced directives. So we talked about that. That's a form. The pulse form is basically that order from the physician once the parent becomes seriously ill. So unless you're already there, the advanced directives is all you would have. The primary care's information. So know who your parent's doctor is, right? So that if you do need to get a hold of them, you can. And then if you're having to take them in or starting to need to shuffle mom and back forth to the clinic or the hospital or urgent care, a copy of their insurance cards is good. And then, financial information. So what are things that if you need to be able to access their bank accounts, things like that, those things are set up for you ahead of time. Proxy access. So your parent's going to have to sign that over to you and allow you access into their medical record, but a very helpful thing so you can quickly review the notes and the results for the visits that they've had and what's going on. And then it also allows you to ask questions. So you can send and message the provider on behalf of dad. You get messages all the time, oh, dad was doing this, or he's in the hospital, or we have this question, or as a follow-up from the last visit, can be very helpful. And then the durable power of attorney, like I said, if that's been granted to you, and it's much easier to do it when your parent is able to sign those things over as with a witness, as opposed to now you're having to go to court to get those things.
Thank you so much, Dr. Martell. This has been a hugely helpful presentation, and your expertise on this. We're just so grateful that you shared this time with us. So thank you. I want to thank all of you for joining us as well. This is definitely a topic that hits a lot of us, especially as we get older. Our parents are getting older. So just want to thank you again for joining us. And I want to invite you to next Wellness Live. So next Wellness Live will be on July 27. That's when we'll be going live. And we are going to be talking about detox diets. Now, if you've seen anything on social media, celebrities, and you can buy juices, really detox diets have really hit a lot of popularity in today's society. And what Esmeralda Valuru, who is a registered dietitian in our very own corporate wellness program, she is going to talk to us about the truth of these detox diets. So we want to invite you there. But again, I wanted to thank Dr. Todd Martell and you for joining us, and we'll see you next time. My name is Dr. Olivia Moses, and wishing you blessings for good health.